I like to say while Congress is debating, employers have been creating, and legislation like we saw with the vote last night, if it goes through, that's a game changer. It changes the fundamental way healthcare was reforming itself with the American ingenuity of creating new products and new ideas. You really can't change that cost curve and get lower products and more lower cost products and more responsive products to people's needs unless you focus on real behavioral change. And our politicians in this whole debate have left the consumer out of it. They've assumed that we can't change our habits on how we use health and health care services and products and needs. They just assume that we're going to continue to be as high a user of unnecessary services. But the reality is that the things you mentioned, health savings accounts, many of your listeners, I'm sure, are very familiar with those, either as individuals who have them or as employers who are offering them up. They have shown by the American Academy of Actuaries study to save in the first year between 12 and 20% and lower the cost increases going into the future 3 to 5% with improved satisfaction, greater physician participation in evidence-based medicine, all the things that we would want. And yet this legislation will basically outlaw health savings accounts. Now, they don't state specifically in the legislation that HSAs are outlawed, but it's a death by 1,000 slices. You have to read through the entire bill. And as I've said before in this program, I've actually read through these bills and have studied them to some significant extent so that you can find the pieces that affect areas like HSAs that are scattered throughout the 2,500 pages or so. But each of those little segments, when you tie them together, basically structure a system that will outlaw this kind of personal responsibility shift that's been going on in the private market, where we now have, as of January of this year, probably over 18 million lives with what I'll call healthcare consumerism approaches, health savings accounts, or a similar, with different features, but a health reimbursement arrangement. Right. Basically savings accounts in addition to the insurance.